Welcome, everyone. Um, I am very excited for this session. I know that you are too. This is our plenary on mental health and sickle cell disease. And a slight change to the agenda, we're actually going to have all four of our experts speaking this afternoon, which is going to be fantastic. I'm going to introduce each one in turn and then let them take it away. So I'll start off with Dr. Sarah Patterson. Dr. Patterson is a hematologist working in the McMaster Hemoglobinopathy Clinic at Hamilton Health Sciences in Hamilton, Ontario. She completed medical school at Queen's University and her internal medicine and adult hematology residencies at McMaster University. She's been working with the McMaster Hemoglobinopathy team since graduation and is undertaking further training in subspecialized care of hemoglobinopathy patients, health advocacy, and health literacy. Very excited to hear from you this afternoon, Dr. Patterson. We have Ms. Sindhu Shikanthan, who uses she and her pronouns and is a social worker at Toronto General Hospital's Red Blood Cell Disorders Clinic. Sindhu brings together counseling with advocacy practice to support patients and has a strong foundation in community-based social work, including areas such as youth work, gender-based violence, housing and homelessness, and settlement services. She also has a background in qualitative research. And I get the privilege of working with Sindhu at the University Health Network. So excited to hear from her this afternoon. Dr. Sandra Newton. Dr. Sandra Newton is an experienced clinician with training in developmental, clinical, and school psychology and has a master's and PhD from the University of Toronto. She has a longstanding interest in advocacy, education, and support for children, youth, and adults with sickle cell disease. At SCAGO, Dr. Newton facilitates workshops and peer support group sessions to support research initiatives, including the vaccination acceptance within the sickle cell disease and Black community from the Public Health Agency of Canada. And she provides supportive counseling to clients. So very excited to hear from Dr. Newton as she shares her expertise this afternoon. And then last, but certainly not least, we have Ms. Tia Campbell. Tia is Canadian born to parents who migrated from the Caribbean island of Jamaica. She was diagnosed with sickle cell disease at the age of 2. Growing up, Ms. Campbell experienced the positive and negative attributes of living with sickle cell anemia. She was told that she was lucky to be living past 25 years and that she would never be able to have children. However, she beat both predictions and gave birth in 2014. Tia has a diploma in social service work, a bachelor's in criminal justice, and over 7 years of experience in social work. She is the social worker and a member of the Patient Advisory and Advocacy Council of the Sickle Cell Awareness Group of Ontario. This is certainly a powerhouse group for the final plenary of the Sickle Cell Summit, and I'll turn things over to you.
So I'm Sarah Patterson. I am a physician down in Hamilton, as we heard, and I have no conflicts of interest to disclose with regards to this presentation. I'm going to start by setting the stage, talking a little bit about the body and mind connection. So when we get into this discussion about what is mental health, because we're talking about how mental health can affect sickle cell disease, mental health is a person's condition with regard to their psychological and emotional well-being. I like this particular definition because it doesn't come with negative connotations of, mental health is depression or anxiety or the lack thereof. Mental health is something that is complex. It incorporates emotional, psychological, and social well-being. And it's something that has really come to the forefront of discussions in the COVID-19 pandemic that has had sort of ripples of effect across many aspects of our lives. COVID-19 really raised a lot of issues with anxiety, whether that's health anxiety, whether that's isolation and being disconnected from family and friends with mandates and how they affected different people. There was an incredible amount of economic stress through the COVID-19 pandemic, and it's been really challenging for everybody. but particularly for people who are dealing with multiple issues, including physical health things, including mental health things, including sickle cell. One thing that we can do to promote our mental health is resilience. Resilience is the capacity to recover from difficulty. Resilience is how we can help make sure we're protecting ourselves, and you'll hear more about that later. Mental health and physical health are interconnected. There are many associations between how we feel when our brains are doing things that we may or may not want them to. There are somatic symptoms, there are body physical symptoms of depression that can make people achy and sore and things like that. That's brought to the forefront, that's exacerbated in sickle cell. When we are anxious, when our body is endorsing our fight or flight response, it can cause vasoconstriction, it can cause our blood vessels to shrink down so that we promote blood to our major areas like our heart and our brain. But we know that in sickle cell, when you have these blood vessels closing down, that can end up with less oxygen getting to your tissues. That can precipitate a crisis that can make those cells start to sickle and cause pain. There has been not a dearth of literature, but there is definitely literature out there to support the fact that mental health and physical health are particularly linked in sickle cell. And many people who are living with it will know that when they're anxious, that can precipitate a crisis. The study I've cited here shows a positive association between self-reported stress and pain based on diary entries using a mobile app that showed a clear association with more stress and more pain. It's an important thing to remember that even, if you do everything perfectly, if you have fantastic control of your sickle cell, sometimes things go wrong. Sometimes there's a crisis, even when you're doing everything you possibly can. And that's hard. That's one of the really big challenges of dealing with sickle cell, of living with sickle cell, is the unpredictability, and how can you make sure that you're always prepared for the unpreparable. So that can definitely, have an effect on what your brain is doing. Many people with sickle cell have symptoms of mental health or mental illness. Almost 40% of people in one cohort of American people, it was a national US survey, had symptoms of a mental health disorder, often a mood disorder. We know that the likelihood of having a mood disorder is higher in people with chronic illnesses, of which sickle cell is one. We know that people who are living in less resourced areas, who are closer to the poverty line, have a 3 to 4 times increased likelihood of having a mood disorder or a mental health illness, according to CAMH statistics for Canadians. So we know that mental health is really important. We know that mental health is connected to physical health. And we know, at least I know as a physician, that it's part of my job to make sure that I'm supporting the people involved in my healthcare team. So what I want to take home from this as a provider of care is that it's important to screen for symptoms. It's important to ask and to see how we can offer support to make sure we're screening for symptoms of mental illness and making sure that we're empowering our patients and our colleagues to speak up and to support our team so that we can get through these challenging days together. And with that in mind, I'm going to pass this over to Tia, who's going to talk a little bit about her experiences of living with sickle cell. Thank you.
Hello, everyone. I'm hoping everyone can hear me today, as I lost my voice, unfortunately. So my name is Thea Campbell, social worker here with Sickle, and I too am a patient living with sickle cell anemia and supporting clients in the South Ontario region. I am delighted to be here today and thankful for this opportunity. I would start off my experiences as a child living with sickle cell. 2 words: I struggled. I struggled a lot because oftentimes, as young as I was, I questioned why I had to be sick all the time, why the pain that I was feeling was so brutal, and why can't it just go away and stop? I wanted to play, I wanted to run, I wanted to jump, I wanted to go swimming and not have to worry about the effects of change in climate, change in temperature affecting me the next day of going to school, missing school trips. My main advocates at the time were my grandparents and my parents. And so the knowledge of knowing what hydroxyurea is, what hydroxyurea could do, I don't even think hydroxyurea was available at the time. I could be wrong. But having even just a lack of knowledge of the social supports that we have today for many years of ODSP, that was not present for me. And this didn't stop either when I entered high school. In fact, going into high school, it was no better because even though I became more aware of the sickle cell disease that I have, I became less interested in understanding it. I didn't want to research about it. I just wanted to fit in, you know, fitting in was my goal at the time, to be normal and to just be accepted as a cool teen who would be there for little gatherings, who would be there for all the sports, who would just be there to hang out after school without having to feel sick. And a lot of times I would do everything with feeling crisis, but this actually aided in my anger. I became more angry. I felt frustrated, and it took a toll on me mentally because when I got into crisis, I shut down completely. I didn't want to talk with anyone. My communication was just nowhere near driven to share what I was going through, to understand what I was going through. I needed to leave the hospital and I needed to get back home and I needed to dress back into my uniform and get back into school like nothing happened. And then I was forced to explain why I would miss school, why I would miss class, why I would miss, functions with friends. And when I became open about it, I was laughed at. I was looked at like, oh my gosh, what is sickle cell? I had parents of peers tell their children that, oh, if your friend has sickle cell, she's not going to live past 25. She probably won't even have any children. And when you're in high school, you learn about having your own family and, having children and stuff like that. So I was definitely, in and out of friendships, in and out of relationships, professional relationships, because my trust was just deteriorated. I didn't trust anybody. I didn't trust a soul. I just did not want to talk about anything regarding sickle cell. Fortunately for me, I have always been a driven individual, and I never let my sickle cell, no matter how much it interfered with my mental health and some of my capabilities to want to go further, I always still found the strength to push through. And so when I entered post-secondary school, which I took a year off first before I even decided if I wanted to go to school because of all the pain that I was going through, I decided that I wanted to attend social service worker program. And entering that program was the beginning of the change that I needed. I learned about my interpersonal skills, which, it means understanding who you are as a person. So understanding who I was allowed me to understand what acceptance is. I accepted who I was as a woman of color and as a woman of color living with the sickle cell disease. And because I was accepting myself, I was able to accept others. I was able to engage into community development. I became aware of, the fact that if you stay by yourself and you won't learn much if you're not inclusive. And so being in the community more and just becoming more vocal and not feeling ashamed of having sickle cell disease actually built my confidence as well, right? I would say with pride, I'd say, yeah, I have sickle cell, but I'm still alive. I'm not going to die, right? And so that increased my desire to achieve more goals. And so I then applied for the criminal justice system and got in. And that was when I became empowered. My third year, I was pregnant with my daughter, who is now almost 8 years old. And I was determined to not miss a day of class unless I had a doctor's appointment. And believe me, I didn't miss a day of class. And then one day I was struggling to get into a classroom. And the professor at the time said she wanted to speak to me after class. So I went up to her, and right away I had a doctor's note to let her know that I might not be a present for a day of an exam, for an exam, but I have a letter. And she said, okay, let me see your letter. She read it and she said, did you know that I have sickle cell trait? Literally tears came to my eye because I didn't have to explain anything to her of what I was going through. Automatically, she knew, and she literally took a piece of paper, went online, and gave me all the resources that were available at that school for me. Some of those resources included more time of exam time, not being penalized for missing a school day, and being offered to my own space to write my exams because, oh, trust me, writing exams and tests, I was either sick before that because of the stress, I was either sick during the test, or I was sick after the test. Either or there, it was happening for me. And I knew right then and there that I was not the only one who was experiencing what I was experiencing. And the feeling that overcame me was so amazing because I felt energetic. Even though I'm struggling with a tummy, I'm like, oh my gosh, I literally told myself I'm going to make it. Everything that I want to do, I'm going to do it. And for me, that moment is a true definition of my empowerment because it just made me really realize what I can do as an individual with a disability, without disability. I learned right then and there that disability has no face because I would have never guessed that that educator had sickle cell trait, you know? And a lot of times people say, you don't look like someone that has sickle cell either. And so this opened up the most awareness for me. And with that being said, I just want to let those know who live with sickle cell or who know others that live with sickle cell that we do have the resources available to us. You know, it's important that we educate ourselves to know who we are first, and then you'll be able to educate yourself on the sickness that you have. Because even though I got all the education, you know, understanding behavior through evidence-based practices and everything, you can't understand somebody else and what they're going through unless you educate yourself and understand who you are as a person, knowing your biases, knowing how to reduce your biases, knowing how to just listen to what that person is going through and to just listen to what that person needs, because you'll be able then to help them achieve what they want to accomplish without even knowing so, because you're just taking away some of that stress from them. And so that is what I want to share with you all today. And also seeking engagement with others and getting involved in the community is really important. You know, we learn from each other. And even though I'm in the profession that I'm in, that's the first thing I always share with my clients, that I can tell you as much and show you as much, but I also want you to communicate with me as well because I can learn from you. And and that's big for me when it comes to engaging, because we don't know how to work together unless we understand each other. And that involves you sharing you with me and me sharing me with you. So thank you all again today for having me. And if you have any questions, I'll be glad to answer. I believe Sandra, Miss Dr. Newton is next.
I do see some comments for you in the chat, Thea. Don't miss those. Thank you for such a heartfelt share. I actually have Sindhu next on our agenda, so I'm going to mute and throw to her.
Okay, thank you, everyone. My name is Sindhu. I'm a social worker at Toronto General's Red Blood Cell Disorders Clinic. Thank you, Thea, for your wonderful presentation. I think it's amazing that, you know, your lived experience, you're using that as a professional service to support patients living with sickle cell disease. So I just wanted to talk a little bit about, you know, my ideas about community-based approaches to mental health. If I could have the next slide, just to kind of summarize, you know, the dimensions of mental health and sickle cell disease. It's like kind of the realities of living with a serious, complex, chronic condition, but also the intersections of managing the chronic illness with other social identities. Next slide, please. And so, people with sickle cell disease, they're managing their health alongside other responsibilities in life. So navigating work, school, relationships, parenting, and all of this can shape, worries, pain, grief, loss, isolation, and adjustment for folks. If I could have the next slide, please. But really and truly, I also see that it is the intersections of chronic illness with other social identities that are also shaping mental health. So folks with sickle cell disease, especially if they're racialized, they're dealing with racism, also intersections with gender, disability, migration, sexuality, and other social identities come into play. And really and truly, I do see that discrimination and social exclusion negatively impacts mental health, right? So not having access to the resources that you need can have a toll. And really and truly, I do feel that there are a lot of broken systems in terms of housing, income support, ODSP rates, criminal justice, labor market discrimination. This all takes a toll. And then also in the pandemic, it was racialized in the sense that we saw Black and racialized communities being disproportionately impacted. And then also, I do think that the murder of George Floyd, it shaped collective racial trauma. And it really came to the forefront during the pandemic in terms of negatively impacting mental health and well-being. May I have the next slide, please? And, as a social worker, I do think, there is a role for counseling support, but also there's also a need to build like healthy communities to support mental health and well-being. I do think it would be helpful for us to be in a society where accessibility and accommodations are readily provided, where we recognize and affirm strengths of people with sickle cell disease, and where healthcare providers, community members, we facilitate access to resources like income and housing, facilitate participation and social inclusion. There could also be peer connection, having supportive networks, as well as caring community members. And I think to Tia's story about the professor who, provided information about accessibility and exams, that what difference that makes. And ultimately, I do think there needs to be policy changes, and this will support, creating more equitable systems that will enable people to support their mental health and well-being. And thank you for your presentation. I'm going to head it over to Dr. Sandra Newton.
Thank you, Sindhu, and thank you to all of the co-presenters in this session. When we're thinking about mental health, I hope it's very clear that we're thinking in broad terms about what supports it, and ways that we can promote it through our practices, through our connections, through keeping things meaningful and responsive. So I have the opportunity to speak a bit about the youth piece. Tia has shared about an adult experience and that transition from being a younger person with sickle cell disease to her adulthood and some of those pieces. I'd like to talk about resilience, and I think resilience became an important topic for us thanks to Sindhu, actually, and her prompt to not just focus on the challenges and things that make mental health good mental health, harder to maintain for individuals with sickle cell disease, but also the things that support it. And so happy to spend some time on that. If I could have the next slide. I'll just begin with, I think what we all know, anybody who hears about sickle cell disease immediately thinks about the hallmark of it, right? The pain, illness episodes, interruption to life. It's not a surprise then that individuals with sickle cell disease, even children and adolescents, will report impact on their functioning in all of the areas that matter to them. I tend to think about health-related quality of life and its domains when I think about any sort of matter to do with sickle cell disease. What are the psychological impacts? What about the ones on social and physical functioning? All of those things matter. And so when we look through the literature, again, not a surprise, we do see that youth rate their own quality of life lower than their age peers tend to, or age peers without sickle cell disease. So there are those detrimental pieces to their view of how their life is and what is making for a good life. I mentioned interruption to school life and friendships. That's one of the most important spheres of development for a young person. And when you're absent from school for periods of time or having difficulty conveying what you're going through to peers, wanting very much to be, quote, like everyone else. This is a challenge when you are dealing with a chronic health issue that can be so unpredictable. I mentioned as well the learning and thinking skills impact. We had a SCAGO presentation recently that talked about cognitive impact of sickle cell disease, mostly focusing on adults, but also youth. And it is true that during childhood, we do discover that for a proportion of our young people, there are going to be effects, not just due to school absence, but just about the processes of sickle cell disease and the impact they're having on the brain and other organs. They're going to have some differences in learning, at least a proportion of them will. And if those are not supported well, if those are not identified in a timely way, I think you can imagine that that compounds the impact of the health condition. And because of all of the things already mentioned and some of the other shares from my co-panelists, it's not a surprise then to hear that self-esteem may be reduced for a proportion of young people with sickle cell disease. Not all, but some may report that they are finding it difficult to not just accept the condition, but also see themselves as being as good, as valuable to others when their life has been punctuated by so much interruption and hardship due to their health. I would say that with that goes the pain, goes the self-image impact, and of course disability. There will be, due to the severity of disease, there will be many folks, even at a young age again, who have difficulty getting around, doing what they want to do, engaging in sports, all of the things that we associate with childhood and adolescence as the normalcy of the time. And yet, because of the way sickle cell disease may be expressing for that person, not having those opportunities, or at least the depth of involvement in them that their peers might. So from a very early point then, already feeling different, appearing different, and having different aspects of the disease process interfere going forward. So we know the risks, as the slide says. I'm hoping on the next page to move into what else we know. We also know that resilience is a key factor in the mental health, well-being, overall functioning of children and youth with sickle cell disease. And what is resilience? We hear that word all the time. And if you look it up, you'll see that there are a range of definitions, but what they all have in common is this ability to move through a difficult time and to do so intact. So I share a definition at the top: building skills to reduce hardship, not remove it, or pretend it's not there, but to navigate it with success. Adaptability is another feature of resilience. So you can imagine how important that would be in a condition where you may not know when you're going to have a pain episode. You may not know when you're going to become ill. It's hard to plan life like one might like to, but the adaptability piece is key, right? Being able to deal with what is. And recovery, lots of different models of recovery, but I think recovery is always about returning to function in the areas that matter to you. So those are markers of resilience. I add in the last point just that, resilience sounds like it's very much an inside job, right? It sounds like your attitude, the things you do, your efforts. But I would also say that it's very much a partnership with the kinds of supports that are happening outside of the individual. What are the systems where they function, from their family to their friendship circle, to their healthcare environment, to school, all of those domains? How are they meeting a person there to build resiliency? So on the next slide, I'm just going to go through a number of things that we know support resilience, children and youth with sickle cell disease. And I hope that not all of these will be surprises, but I do think that at the end of the day, I really hope it highlights our opportunities to support our young people who grow into adults and who, in many cases, are looking forward to a life, a future that can be fulfilling and can be rich. I mentioned it's the final point on the slide, but I really hope you'll hear as I go through these, the importance of planned competence. In other words, thinking about the life of that young person and how to build in the supports along the way in a proactive way, in a responsive way that help them realize what a good life can be, even with a challenging health condition on the table. So I think one of the best ways to find out about ways to support children and youth and their families and adults is to ask. You did hear some of the panelists mention that already, and there are a lot of ways to do that. I've mentioned health-related quality of life here just because it's a special interest of mine. There are a number of wonderful screeners and surveys out there, and they do tap into things like mental health and psychological functioning. I'd really love to see that as an aspect of the follow-up appointments. They don't take a lot of time to do, and yet they yield rich information. Not everything is volunteered, but by asking, we can actually get some of those important conversations going, identify where there's risk, and start doing things to help mitigate that. Supporting families. A key theme that comes up in the literature on working with and supporting youth with sickle cell disease is that we need to make sure the family is well. And I don't think that there's a lack of families or individuals tuning in to this talk, to the whole summit, who haven't been there, right? The challenges of supporting their young person through times of uncertainty, difficulty with function, the toll on parents and caregivers, right? So supporting families and making sure that they have what they need tends to be a very important part of supporting the young person in their resilience. If a family or caregiver's mental health is checked in on, supported in very practical ways. Sometimes it is items, sometimes it's respite, sometimes there are other things that we can do, goes a long way toward helping make them available to support their young person through the challenges they're experiencing. I think that school supports and their importance can't be understated. You know, as I mentioned earlier, there are going to be a proportion of young people with sickle cell disease that have learning challenges that are associated with the disease process. And what we want to do is we want to be proactive. I think that's sort of my word of the day. There are so many things that can be put into place when schools know more about a young person's, not just their physical condition, but are also keeping an eye out for and monitoring the learning process in a very systematic and routine way. It allows us to put accommodations in place that are going to work and open up resources. I think Tia even mentioned the importance of resources in the post-secondary phase. So that never goes away as an important piece. So if schools are aware, we want to move them beyond the, coming in out of the cold during the winter and staying hydrated to thinking about how do we plan this competence for this young person? How do we get them what they need early and continuously? I am a firm believer in the importance of teaching skills. And if a young person's not performing something, I tend to come from the lens that they haven't learned that skill yet. And the nice thing about learning to cope with a health condition, with anything that one is dealing with, is that you can learn skills for it. And there's a range of information out there around positive coping. But, coping itself is interesting. There are a lot of ways to cope, that some more positive and some less helpful. And they have their time and place. But I think that if we are, during those times when a young person is feeling well and available, teaching them some things that they can do, strategies they can use. I mentioned relaxation further down in this slide, even being able to, express what they need, being able to engage in activities they enjoy, keeping them going, having that kind of coping kit or toolbox ready. I think that goes a long way as well. It increases their sense of control and agency in a condition that's very hard to navigate for so many. I think part of that toolkit needs to include education about sickle cell disease, and not in general terms, but about their health course, right? The things that help them and help support them and help promote their wellness. And I hope that we are all thinking about wellness in an expanded way as well. It is psychological as well as physical. It's spiritual. It's an expanded definition. So let's think about what helps that young person to do their best, even when things are challenging. I speak about self-advocacy on this slide, but I think that I would almost put an asterisk next to it. I think that so much of what we talk about when we talk about successful coping and resilience speaks about those personal traits, you know, the stick-to-itiveness, the, you know, being determined, all very important features. And yet, I don't think it's an inside job alone. I think that we need to have partnerships with our young people and continue that as they become adults. So self-advocacy can be challenging in big systems like schools, like healthcare. Can we anticipate that our young people do have needs, inquire about them, and respond to them in a timely and thoughtful way? Can we understand too that they're not just working within the sickle cell world, but the intersections that's been discussed in this talk already? Anti-Black racism, racism that racialized individuals experience. This is part of their reality as well. Can we make sure that the contacts that youth are having with healthcare, with those other institutions, are positive and supportive ones? Let's make it a partnership rather than putting all of that onus on the young person who's navigating so much already. And I'm a big believer in community. These are things that come from research done into resilience, but it's nice to be able to reflect on activities that are happening now and that we've been able to do certainly through the Sickle Cell Awareness Group of Ontario. Youth groups, you know, having an opportunity for families to come together, peer support, that can start at an early age. And it provides that space where you don't have to explain. Others can tell you about their experiences and share what's worked for them, and vice versa. Or you can put that aside and just be kids. So having that community of understanding, ideally with peers with and without sickle cell disease, is super important. So I think that is where I'll leave that summary. I hope that if there are any questions for us, that those will follow soon. Thanks for posting this slide, which talks about the Sickle Cell Awareness Group of Ontario, or SCAGO, and it is a key resource for children and youth and adults. I would say that across the lifespan, we can be found in lots of social media spots. So with that, I'll pause and hand it over to our moderators. Thank you.
Thank you so much. I think you can see in the responses that you've been getting in the chat how much your discussion today has resonated with the participants for the summit. So lots of fantastic practical information, lots of insights about your experiences. I encourage all of the participants, please do put your questions in the Q&A. We have a group of experts all bringing their experiences, their training, their know-how here to be available to answer your questions. I wonder if I could start off with one that I started to think about a lot when Thea, when you were talking about the educator who had that level of experience and know-how and that sense of relief that you felt in working with them. And I imagine that as a social worker, that the folks that are working with you get to feel that sense of relief as well, of not having to explain all of that background, all of the parts that that can then go unsaid. I would like to hear from the group about any work that's being done or that you might be involved with to help increase representation. And so encouraging folks that are living with sickle cell or have families who are living with sickle cell to take on roles of being able to be supports in the community. And Dr. Newton, I see you nodding. Do you want to start off to address that?
Wow, I can certainly try, and I do hope that my co-panelists will jump in. I think that actually for like the one that we're in, the summit, are a great example of having individuals with lived experience be a part of the planning from the ground up and to share, to moderate. I think that that's a great example. That's actually the handiest one that I have. I do know that in the peer support group that SCAGO has for adults, we've had individuals from that community be the presenters as well. The ideas for what we talk about do come from caregivers and individuals living with sickle cell, but always more room for this, and I'm glad that you asked the question. I'll throw to someone else that might like to comment.
Yes, please go ahead.
I'll say something as well. So thank you for that as well, Sandra. And so yes, my experience talking with clients. At first, when I do encounter a client, I can tell that they are not comfortable with sharing some of the experiences that they go through. So I don't waste any time. I let them know right away, listen, I have sickle cell. And I can feel that relief through the phone, in person, just come right off of them, because again, like growing up, I did not want to talk about it. I didn't want to talk about it. And that is the key component for me in understanding, even though they reached out, they're not comfortable. They just reached out just because, but that just because would open so much doors for individuals, and they don't know it until they just make that call, because you don't know who you're going to meet. You don't know who's going to share that same experience with you. And so that educator, I will always take that experience with me in my heart, and I have no problems disclosing my diagnosis, because I want anyone that I speak to feel that comfort that I felt that day, that relief that I felt that day. Because again, like, not only does it open up so much doors, but it just offers so much space of trust, and we can just build rapport together in point zero seconds, and just start moving, like what needs to get done, what have you been going through, how can we stop it, right? So we want to address all the issues right away off the bat, and then have people move to a better comfort of living. You want to increase their well-being, you want to increase their wellness, and knowing that you have someone to talk to that goes through what you go through. I still go through my pains. My pain is not going to go away, so it's under control, but it's still there. And even me sharing that with the client helps me feel better, because I know that they know what I'm going through, right? And that's big for me too, even today in my age. So again, like, just you just don't know who you're going to meet. So I definitely encourage just trying to just understand who you are, accept who you are, and just share it, because the resources are here. We are here. We are here for sure. Yeah.
That's incredibly powerful to hear, and I can only imagine the sense of relief that your clients get when they meet you and when you share that disclosure with them. I'm seeing that we have a question in the Q&A, which is fantastic. Please do keep those questions coming. The question here is, as an adult, how do you get help to change those patterns that were developed as a child in crisis? In terms of, it says psychologically, so perhaps in terms of the coping strategies that you've built up, the patterns that were established when you were little.
I wonder if I think we might all. Oh, sorry, Tia. I thought that you were sharing, but muted. I'll hop in here, but I would really love input from others on the panel as well. I think that we need to look back, and I know that I'm not someone with lived experience of sickle cell disease, but I will speak in general terms and hope to hear whether that resonates with people. I think that we need to have some compassion for the child we were, the ways that we've coped in the past. They were meeting a need. We were doing our best. And I think it's amazing to now be at an older age and stage, I would think, and to be able to reflect and say, does that still work for me? Do I need something more? And to be able to, now that you are an adult as well, not wait on a parent or somebody else, but to be able to actually go and request that. And I think there are a number of great ways, because I do think that skills can be learned no matter how old we are. And coping is one, right? There are a number of ways to do that. Sometimes it's a one-to-one counseling situation. I know that Tia and I provide some of that through Sickle psychosocial service. But there are also hospital-based programs. We don't have large programs on the psychosocial side, but they are mighty. And I know that that is a great place as well to get connected with not only disease-specific types of coping coaching, but referral to other community-based services that can carry one forward in that self-exploration, learning to manage, and so on. So I think it's just a matter of wanting to learn, seeing that you need new skills, and being able to share that so that there can be that bridging. But I will let others chime in, please.
I'll
Yeah, I
jump
think,
in
Yeah.
to answer this question as well. So,
Yeah.
Periana, thank you for your question. So, the first word that comes to me when you discuss having to change the patterns that develop as a child is forgiveness. Okay. And the reason why I say forgiveness is because part of the psychology is blame. And you can't blame yourself for what you experienced as a child living with sickle cell. And that's something that I learned. So I'm sharing this learning experience with you. I cried for years. I cried for years. I'm not going to hide that I cried for years. I was very emotional. Oftentimes, I'm still emotional now because you remember what you go through and you think you've passed it, but then something happens again and then it reminds you of how you felt back in that time, right? And so, moving on to your next question, presently now, I still struggle with time management and self doubt, right? As a mother, it's hard. It's hard because if I fall sick, I need to know who's going to be there that I can pull from the sky to watch my daughter right now because I need that support right now. I've ended up taking her with me to emerge in an ambulance because I didn't want to bother others for, leaving work early to help me. I felt like I was an issue. But when I spoke to a neighbor, she said to me, "You're not alone. You're not alone." And even though I knew that, that moment of being in pain and having to figure out what's going to happen to my daughter right now, because fortunately I still have my parents who still work. Um, and I was living far from them, and they would always rush to my side because they're like my best friends. But you don't want to bother anybody. You don't want to bother anybody, and I totally understand that. But you're not a bother. You're not a bother, and you're a human being like everybody else because somebody else may need your help, and they may not have sickle cell. So do not be afraid to ask for the help. And again, a lot of things that happen to us are beyond our control. So you have to know that as an adult now, what you went through as a child wasn't your fault. You're forgiving yourself for being mad at yourself. And now you're going to do everything possible that you can to prevent feeling this way anymore. Right. And even if you fall back to the feelings, it's okay. It's okay. You're a human. We have emotions. So don't be afraid to feel like, wow, I went through a lot, but you know what? I'm here now and this is what I've accomplished and this is what I'm going to do tomorrow and this is what I'm going to do the next day given that I'm still alive. And just, just tell yourself that you're fine because you are fine. You're fine. You're normal. You're breathing. You every day is an opportunity to just achieve what you want to achieve and to keep pushing forward. So don't, it's hard and it's easier said than done, but try not to live in the past of those emotions that are negative for you, but live in the moment that's positive for you now.
Fantastic, Thea. Thank you so much. Sindhu, I think that you had unmuted as well. Did you want to, that's tough to follow. That's tough to follow. And we've got responses in the chat there as well. People describing similar experiences, talking about the link between pain episodes and mental health, and the cycle that exists there, going back to the idea of compassion for ourselves, and understanding that that we are people that grow and change and can adapt over time. So lots of great engagement there in the chat and in the Q&A. I wonder, for the group that is gathered, so many experts here, many parents in Ontario are going to be having kids spending a little bit more time at home, it looks like, in the near future. And I wonder from the group, some practical suggestions for kids, especially kids that are living with sickle cell that may already be having struggles with keeping up with school and maintaining relationships with peers. What kind of suggestions can you give for those parents that are trying to support their kids?
I'll take a go. I think that the whole virtual learning circumstance of the COVID-19 pandemic has put pressure on families in ways that weren't imaginable before. Been a lot of learnings. It's also been, for some, a positive way to engage, a way to get some more support, interestingly, for an individualized support around learning. It's highlighted needs in a way that they might have been missed before. And so in that whole planned competence idea that I was sharing earlier, I'm saying let's be as proactive as possible. This may be short term, but what can we harness and leverage to support our students, whether it's making times with the teacher, whether it's keeping children engaged and in contact with the learning, even a little bit daily, right? Whether it's being able to just keep it fun, keep that routine going, and yet also make sure that we're getting just, I think, that regular contact with what needs to be learned, so that going back will not be an additional stressor because of an expectation of having kept up over the days that they're out of school. I think technology has done wonders. A number of young people have technology access as part of their any sort of special education accommodations. But I would say that if that is not a current support, something to look into even when we are back in the classroom. I think that it's been a way of bringing learning and making it more accessible to youth in ways that traditional learning circumstances haven't provided. So I would say maintaining some routines, keeping that engagement going. There are a lot of special education and other supports that will still be available virtually. Find out from your school and the school team. And then at home, maintaining that contact with it, talking about learning. How are you finding it? This is a great time actually to engage in those conversations. Do a check-in with your child if you haven't had a chance lately to see how this whole school thing has been going. We're 2 months in, and there are some learnings and opportunities to pivot if we need to. So I would share that and invite others to share their thoughts if they have them.
Well, I work with adults, so I'm thinking about the parents with sickle cell who are going to be impacted. And I'm also thinking about like the moms, because we do live in a society where unfortunately the caregiving does impact women, right? So I think it's really important to, build space for yourself, right? It is going to be hard with the lockdowns. Like that's what my mind is kind of going to, and how it impacted like the moms with sickle cell disease, right? So, building space for yourself, right? Acknowledge it is hard, right? And asking for help is going to be important. And yeah, like it is okay to reach out during that time. It's going to be stressful, I think, right? For the parents. But yeah, I just wanted to share that piece from my standpoint.
Well, I think that's a very good perspective, Sindhu. So the impacts on kids as well as the impacts on parents. And Sarah, I wonder if that goes back to what you were talking about in terms of resilience and how mental health isn't just discussions about things that are missing, but about a positive view of mental health. Do you have thoughts about in terms of the resilience piece and how that might apply in either in this situation or in stressful times?
I think resilience, whatever resilience looks like for you, because sometimes resilience gets bandied around as some sort of band-aid to make everything perfect, and it's not. I think that, finding your safe place, finding your safe team, finding somebody who understands and will actually listen to you goes a huge way for validating somebody's experience, for ensuring that we actually, as a provider, that I understand, just because I think your problem is this, And then it's actually that. If I'm not listening, I'm not going to be able to help. So I think, finding your safe people, finding your safe outlet, knowing that it's okay to not be okay for a period of time, and that not every day is a good day. But, Lance Archer had a presentation yesterday about the psychological impacts of pain and how not catastrophizing and how you can use your mental well-being to help support yourself through those bad days, and things that I think was also really powerful. So I think it's, sickle cell is not it feels, I'm sure, very individual, but it is a community thing. You can't walk this road alone, or at least that's the impression that I've had as someone who doesn't have sickle cell. And being part of a team that can listen and be safe and help and work together so that we're all in it together for the best outcome, I think that's the most important thing.
Fantastic. And I think really links back to Thea, what you were saying about community and about the importance of those supports and about being okay to ask for help, knowing that those same people would want you to do exactly that, right? Yeah. We have just a few moments now before we wrap up this session and head back for closing remarks. I'd like to give each of you a moment to give your last piece of advice for today, either to people living with sickle cell, to family members, to healthcare providers. What's one thing that you really hope that they take away from the discussion that we've had today? And Cindy, maybe I'll start off with you.
I think I would say use accommodations, activate that human rights discourse, disability, racism. Those really go a long way. I think that can be really helpful. And you can always, if you're connected with RBCD Clinic, you can always connect with myself for supportive documentation.
Fantastic. Thank you so much, Sindhu. And actually, before I share that question with the rest of our panelists, we do have an attendee who has their hand up. So I want to give Beatrice an opportunity to ask her question. I'm going to just unmute you here. And Beatrice, you should be able to go ahead and unmute and ask your question. So she may be having some trouble unmuting. Beatrice, if there's a question that that we can help with, please do put it in the Q&A. But I will continue on, and perhaps Dr. Patterson, same question. What's one thing that you would like people to take away from your session this afternoon?
I think, find your safe person, find someone. I'm hoping that everyone can have a safe person, a safe healthcare worker person who can listen and help you hook up, whether that's your doctor or your team social worker, your family doctor. It doesn't have to be a particular person, but I really hope that you can find a safe person who can help you through the difficult times and help navigate our healthcare system, which is not perfect.
Excellent. Excellent thoughts. And yeah, I mean, you're right. We're working within an imperfect system. But I think that, hopefully some of the advice and ideas that you shared today will be helpful for people in navigating that. Dr. Newton, one thing you'd like the participants to take away from today?
Sure, tough question. There are so many great takeaways, but you know what? I think asking the question is important, including of the very young when we're talking about mental health and well-being. How are you doing? Showing that curiosity, looking for the changes in functioning that can signal that a young person's having a challenging time, and using those times when things are fairly stable and steady to really be purposeful and intentional about teaching skills for coping and really reinforcing that, modeling that. that positive coping strategy so that kids do have a toolbox they can carry with them. That'd be my wish.
I think that's an excellent reminder, right? That we're not all happy or sad people, that these are skills that we can develop over time. And I love that idea of putting the tools into our toolbox. All right, and I'm going to let, you should have the very last word today. So what would you hope that participants from the session will take with them?
So I hope I'm allowed to say more than one. I'll try to go as fast as I can. So just to touch up on what Dr. Newton just said about coping strategies. So I'll just with the parents first, for any parents that are present today that have children with sickle cell. I want you to know that, and this is from my personal experience with my parents, is don't be afraid. I understand that, especially during these times, it's really hard right now, especially with the inflations that we're going through. But do not be afraid to stop working to be there for your child. An employer once told me that you need to listen to your child because sometimes children get tired too. They get tired of going to school every day. They get tired of playing, and if they're sickly, they just get tired of wondering why they're sick. And I'm coming from that experience. So do not be afraid to just let your child know that they come first and you want their well-being to come first as well. Secondly, health is wealth. So with health being wealth, you need to communicate of the resources and of the supports and of the needs that you need. And just again, reduce your fear, because when you're living in fear, you add more stress to yourself and you don't want to share what you're going through. But when you just find your strength as a parent and as someone living with sickle cell, you become motivated and you want to remain empowered to just reach for every opportunity that's available to you. Exactly what Cynthia said, all to take advantage of the resources that are available through healthcare system, through the social through the social assistance. Um, Disability has no face. It's not just sickle cell, but as a team of sickle cell right now, you have a huge community of members, healthcare providers. Talk to somebody. Somebody knows somebody else that can help you. Somebody has the connection to the resources. We are all a community here today, alive today. So reach out to someone. Do not hesitate to reach out to anyone. I'm begging you today. Just reach out to what you need because the support is available. Thank you.
I think that's the perfect way to end this session. Thank you all so much, Ms. Campbell, Ms. Camden, Dr. Newton, Dr. Patterson. You'll see in the chat a link to the evaluation for today's summit. I invite you all to join us for the closing remarks that will be starting immediately after this session. But I'm posting the link to the evaluation there just in case. It really is very important for us to hear from you about the summit so that we can understand what ways to promote collaboration and learning in the future. So thank you all again, and please do join us for the closing session.